Good evening. Chairman Dunlap, Commissioners, Manager Diorio, appreciate the opportunity to give you an update on the situation and where we are in this county in terms of our preparation. I have with me this evening our Assistant County Manager, Anthony Trotman, as well as right behind me, Dr. Meg Sullivan, our Medical Director at the Health Department, and Angela Lee, who is our Assistant Health Director for Preventive Health, which oversees our communicable disease response. So I appreciate that they're with us here tonight and part of our response team as we're moving forward with these efforts. So I just wanted to give you a brief update on the coronavirus and the COVID-19 outbreak. I want to emphasize the fact that we are following CDC guidance in every step that we're taking on this. We're making sure that we are in lockstep with our federal as well as our state partners on these issues. I want to reaffirm and confirm that we have no cases at this point in time in Mecklenburg County. There has been one case in the state of North Carolina, and that case was directly linked to an outbreak in Seattle. The individual had been to Seattle and had actually been to the facility where many cases have been identified. What that continues to mean is at this point in time, we do not have confirmed community spread in North Carolina. I will state that that could change at any time, but at this point in time, that's the situation. With this event, Public Health is the lead agency on our community's response to this situation in Mecklenburg County. Our first level of response is prevention. How do we help our community stay safe, and the individuals in our community? And you've all heard these things before, but I'm going to take the opportunity to repeat them. Washing your hands with soap and water frequently for at least 20 seconds. And I know that's hard to do. My granddaughter sings happy birthday twice and knows that she's washed her hands sufficiently. If you don't have access to soap and water, using alcohol-based hand sanitizer is a good move. Cover your mouth and your nose with a tissue or your sleeve, not your hands when coughing or sneezing. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick and get the flu shot. It's not too late for that. Unfortunately, we have a flu season that is still moving through our community. In addition, with everything that's blooming outside, we have allergies. So it's difficult to know when you're next to somebody who's coughing and sneezing what they might be presenting to you. So just use your best thoughts on what you need to do to take care of yourself. When it comes to the issue of social distancing, we've been getting a lot of questions about that. We expect guidance by the end of the week from the CDC on social distancing. We have not received any of that so far, so we're not making any determinations about what our recommendations are in that area. So our planning for the second level of response occurs when we have a confirmed case. In that response, we include isolation and quarantine. I want to help you make sure you understand the difference between isolation and quarantine. I think that's important for the public to understand. Quarantine is when we ask individuals who have potentially been exposed to someone who is infected to stay home for 14 days. You've heard before that we were monitoring people that were coming from China. These were folks who were not infected but had potentially been exposed. And we were asking them to stay home for 14 days. That means no school, no work. Right now, the new CDC guidance includes those who are returning from high-risk countries, all of them. That includes China, Iran, Italy, and South Korea. So any individuals who are coming back from those countries at this point are being asked to self-quarantine for 14 days. Isolation, on the other hand, is what we do with individuals who are confirmed to be infected. We need to remove them from the general population. They will be isolated until they have 2 negative test results within 24 hours. That could be more than the 14 days that we see with quarantine. We are developing options for those at this point who may need isolation and who do not have a place to be. We're also working with our first responders across the county and with our healthcare systems and clinicians to develop and implement their plans for response, to make sure that we are coordinated in our efforts and that we're all on the same page in how we address these issues, and that our communication with the public is consistent. The county's working on policies and procedures for county employees regarding response and other HR issues. Those policies and procedures will be based on CDC guidance and will be coming out within the next day or two for our employees. We're also working on a regular basis on communicating with the community about this issue. We do have a website, the county website. You will find the specific website on coronavirus and on COVID-19. We are updating that website daily. We are seeing this from the very beginning has been an evolving situation that takes daily evaluation and changes in our messaging. So we are changing that daily. On that website, there are links to all of the guidance that CDC has provided to us in this effort. And there's also any specific county information that may be available to the community. Tomorrow morning, we will, well, actually it's up now, but tomorrow morning we will have a COVID-19 information line that will be available to the community. That number is 980-314-9400. On this line, you will have several options. Option number one will be for those individuals who are at increased risk due to travel or have potential exposure and are experiencing symptoms. Those calls will be routed to some of our staff who are working specifically with individuals in that situation. The symptoms include fever, cough, or shortness of breath. The second option will be for our medical providers, and that again will go to our clinicians who are working on these issues and can answer questions that our medical community has when they're working with clients that they're seeing or patients that they're seeing. The third option will be for the general public. So individuals who have questions, who have concerns, who feel the need to share information, we will be answering those calls from 8 to 5 every day. And number 4 will be for the media. So any calls that come through will go directly to our public information staff. And the 5th call will be available for community service providers or community partners who have questions, and we're getting lots of those about what they should be doing, how they should be planning, and what they should be doing in terms of restrictions in their work environment. So we will have answers to those questions as well. In addition to that, our public information folks are putting out social media on a regular basis. We're also developing posters and flyers that should be on our website either tomorrow or Friday that individuals can download and use. These can go into any public space where individuals are coming into offices that give information about what people can do to protect themselves, but also some general information about COVID-19. So those should be available by tomorrow or Friday at the latest. We'll continue to develop messaging that is pertinent specifically to Mecklenburg County, but at the same time, we are also referring people back to the guidance that's coming from CDC because we want to make sure that we are having a consistent response to this situation. I'll be happy to answer any questions that you may have.
I think what we've agreed to do, Gibby, is for the media who has questions, you're going to be in CH14, is it? Mm-hmm. Okay, CH14, so if the media has additional questions, this is just to provide an update, not a discussion, but if the media has questions, she will meet you in CH14.
Thank you.
All right.
Mr. Chairman,
Yes.
I'd like for her to restate the telephone number, and I want to know if this information will be printed for the general public to get copies of her report tonight.
Yes, ma'am.
Amenable to the public, and that's why I want to know if we're going to put the information you gave to us tonight on paper so we can get it to the public. That's number 1. Number 2, we do have a health committee. Susan serves on that committee. Mr. Mark Jarrell serves on that committee. Ms. Powell serves on that committee, and I serve on that committee, and we were appointed by the chairperson of this body. So this is my first hearing as chairperson of that committee, and I would hope that you would dialogue with this committee so we can be of assistance and we just not be a haphazard group sitting around. That's number one. And number two, we've been taking our meetings to the public so that the public could get the information about good health living. So if you would communicate with this committee, I certainly would appreciate it. So don't ignore us as servants of the people.
Absolutely.
So Ms. Leak, let me tell you how this came about. I heard in the media that there had been a case in North Carolina. So I called the manager this morning and asked the manager if she would make Ms. Harris available so that we could inform the public this afternoon. So I made that decision. So you are not being ignored, and the committee, the health committee, will get all the updates as they become available. But due to this situation, I wanted to start off our meeting informing the public of what had taken place.
That's fine, Mr. Dunlap.
All right.
I only wanted to make sure that the public is aware you have a health committee. That's number one. Number two, all of us heard that announcement on radio, television. So I'm not lambasting what the manager has done. I'm only trying to build on it so that the public will know. And as a member elected by the people of Mecklenburg County, I can ask the questions and help to disseminate this information. I'm not after the county manager or after you. So we do play a role on this board besides you being chairperson.
All right, thank you. And so Ms. Harris will see you guys in CH14.
And
So-
I will tell you that PI is, our public information folks have videotaped this presentation, and it will be posted on the website,
And the
so the
number
community can
again?
find it.
Phone number, Gibby?
The phone number is 980-314-9400.
And depending on which option you select determines whether or not there'll be a 24-hour response, right?
Exactly.
So there's some that
Thank
the
you for that.
information requests are from 8 to 5, and the others who actually have concerns about being
We
sick.
respond to the medical
24
community
hours.
24/7.
Correct.
Yes.
All right, thank you.
Thank you.